My name's Second Robert, uh, the chairperson, Spinal Injuries Association of Uganda. We are a membership organization based in Uganda. We work in 10 districts in all 4 regions of Uganda. We work with people with spinal injuries. Our major concern in that is lobbying for them, uh, building their capacities, uh, lobbying for fighting for their rights, and rehabilitating them, rehabilitating people with spinal injuries and their families. So today's theme is trying to reduce on spinal injuries by teaching people, training people, the societies on how to evacuate accident victims, among whom many times happen to be those with spinal injuries undetected yet, but which would have been sometimes avoided. And they do happen because people, the first responders that happen to come to scenes, don't know how to manage the patients. And this mishandling many times causes lifelong ailments or disabilities, which would have been avoided if people knew what to do with the patients in such situations. In the communities, many people with spinal injuries, especially those ones that are attained after living some time in normal life, people, when they get an injury where they can't, spinal injury comes with many challenges. And these challenges, when you've not had a chance to have a training on how to manage oneself, many people tend to fail to get back into society because a spinal injury comes with issues like incontinence, which if somebody has no idea or is not been trained on how to manage, is one issue that hinders people getting back into societies or getting back to becoming useful citizens again. Other barriers are accessibility. Many of our homes are not accessible with people with a spinal injury because many homes are not accessible to wheelchairs. With this kind of life, many things in a home sometimes got to have to be changed. Areas like bathrooms, like entrances, like doorways in the houses. Some families find that have to get them widened to allow a person with spinal injuries to freely move again in the house. And that's one way that enables one to mix back into society. Because if you have no accessibility to areas vital to our living, then you are denied of that right of being a useful citizen again. In the communities, stigma is one issue that we do really try to manage by doing peer counseling to these people with people with a newly acquired spinal injury, because this is a situation which changes one's livelihood. It changes the way one has been living to a difficult situation. So many people end up being stigmatized because they cannot come out openly to express themselves what they are going through. they take some of the issues like incontinence so private, and with no one to guide somebody or to counsel somebody, many people end up in houses hiding. Many don't go back to their professions, to their employments, to their sources of income after spinal cord injury. And it's one of those big major areas that affect very many of our members, because that means losing income, becoming dependent, which in the end sometimes also tires the families, over depending on them. An adult, you can't imagine having an adult or a head of a family now becoming dependent, and what happens to the family later. I needed a lot of counseling and a number of trainings to get me back to the normal self. Uh, my mental health first, uh, giving an example on myself, before injury, I I had a different profession. But after an injury, I could not cope back with that very same profession. So that stigma of now being not able to do anything for yourself, depending on others, you cannot go out, you have lost all the income. It's something that puts people so much back, because you have to rely on someone, and many people, it's just a few that have someone to rely on. A lot of people have nobody. Sometimes one has been the bread earner for the whole family, for the whole more than 2, 3 families, and he gets an injury. That is a complete breakdown for all the family, not only that one victim. So you can imagine now how many are being stigmatized just because of this one individual who has got a spinal injury. The biggest challenge, I'd say, is finding way of getting almost all the society, getting into all the society, dispersing news, information to societies is, I think, here, depending on following our character, our culture, it's not easy getting people all together to at least give some information to, or to teach people about how to avoid this, how to try to reduce on the occurrences of spinal injuries. So it's not an easy thing. It involves a lot of finances, which is not an easy way to find a source that can enable you to do what is necessary. SIA cannot be able to reach out to each individual in the country or even beyond. So the few we have reached out to, I call them to keep spreading the information, share what you've learned with the other. Appreciate the Red Cross, the Uganda Red Cross Society, for partnering with us into this struggle to at least get people to know how to evacuate victims from their accident scenes. And this I call upon all the VHTs, all the public, to at least support where need be, to sensitize people on ways of how to avoid getting a spinal injury, because it's one of those very challenging situations, conditions that are costly, expensive to manage a patient with a spinal injury. Not all healthy centers can manage people with spinal injuries, and I call upon government to at least consider up to a level of health center 4 to have specialists that can manage spinal injury conditions, because at the moment it's only referrals and big hospitals that can manage this condition. By 2030, at least if we could have, if we would be able to have reached almost all the districts of the country, trying to spread this news and forming associations, forming clusters. If this can be done in all districts of the country, because forming clusters of members with spinal injuries is another way to bringing closer the counseling, the rehabilitation services to people closer. Calling on to our local governments to consider services and accessibility to services for people with spinal cord injuries, and not only those with spinal cord injuries, but all wheelchair users and other conditions like people using clutches and other assistive devices. If all local governments would at least have a particular office to attend to this class of people, and when they are doing their budgeting, to at least include our necessities.